Shame is a universal feeling, I think, among people who are dealing with addiction and recovery. Would you agree with that, Nicole?
100%, yes.
Tessa?
Absolutely.
I would say the same. And what that sometimes does is it prevents people from seeking medical care. And that's something we haven't talked about before. And I remember when I was deep in alcoholism, it'd be like, I don't want to go to the doctor because I know what he's, and when I did go, they do blood tests. And they say your liver's screwed up. And I'd say, well, no, I sort of understand that because of all that I drink all the time. And then they look down at you and say, well, you shouldn't be drinking as much. And so then it deters you from going to seek medical treatment.
Yeah.
And people in addiction and recovery need medical treatment, right? So that's what we're going to talk about today because it's something we've never explored before. So welcome to another edition of Odyssey House Journals. I'm your host, Randall Carlisle, my co-host, Nicole Slack. And our guest today runs a medical clinic where there is no shame, right?
Absolutely.
Tessa Basinger is in charge of the Martindale Medical Clinic. And for those of you watching around the world and around the country, that is in Salt Lake City. So I guess if somebody called from far away and wanted to come, they could, but
we would take them, yes.
Doesn't make a lot of sense. I think it's important that, and what impresses me about your clinic is that there is no judgment, right? So explain that.
Absolutely. I think those that are in active addiction and maybe coming out of it or maybe not ready yet have experienced exactly what you've experienced. And our mission is to provide loving, safe, no judgment health care for every single person that comes in to see us. And what that means is a lot of our people start coming to us in the midst of their addiction, and they're not ready to quit or stop. But we provide a non-judgmental place where they can come and we establish that relationship with them. And then when they're ready, on their terms, we are there to help them if treatment or other options for sobriety are what they want to do, but they drive that.
So I'm an IV addict, and I come in with a wound issue on my arm where I inject or something. You don't say, if you stop doing this, you wouldn't have that problem.
No, I think people that are in addiction have enough of those people saying those things to them. I mean, we're honest, and if there's a wound and it's caused by, needle use, we want them to use clean, safe supplies so that they're doing the best they can to keep themselves healthy. And then, of course, we'll treat the wound, we'll treat the abscess, antibiotics, all of those things to make sure that they're the healthiest they can be.
And some of the peripheral things that happen with people who are homeless, who are in addiction, are things like STDs or Hep C or AIDS. How do you deal with that?
Yes, we provide all of the testing. In fact, Martindale is known to be the largest clinic that diagnoses, treats, and cures Hep C in the state of Utah. And we're really proud of that. And
I didn't know that.
Yeah.
Wow.
And for any STI, we can test, we start treatment. Yes, we handle all of it.
Now, treatment for Hep C, if you're paying out of pocket, is expensive as hell.
Absolutely. And that's why we have a team that specializes in helping people with funding. And also we can nominate people to be in the ECHO program for Hep C, and where their treatment and medication is covered. So we are their advocate for them.
Wow. Nicole, did you still go to the doctor when you were in your drinking days?
No. In fact,
See.
I hadn't been in a really long time. And when I got admitted to downtown, they were like, we're taking you to the clinic. And I was like, I can't afford that. And they were like, no, it's a part of Odyssey. Just go. And my care was different. I got psych care. I saw a psych doctor once monthly to get my meds and to get it all under control and make sure I was on the right ones. We had to switch a little. And I saw him regularly through my stay with Odyssey.
So that was your first time in a while.
Mm-hmm.
Wonder why it is that we're so. I guess it is shame, isn't it? That keeps you away from a doctor when you're in active addiction.
And I also I knew I needed medications for my anxiety and my depression, but I was drinking so much. And I knew enough to know you're not supposed to mix those. So I had dropped off all my meds and everything. So I was really embarrassed because they were like, so this works for you? And I'm like, yeah, but I choose alcohol, so I can't have my meds. And I didn't want to have to admit that to another person. So when I finally got back to going to the doctor and getting on meds and doing all of that with no shame, and it's just like, okay, well, you're working on yourself. And my nurse that I saw every time was so cute, and her and I she was my little cheerleader of like, you're back, you're doing so good. And, I had some problems with my eating at the time, and she and I would talk it out. It was a really warm experience.
It's wonderful. I, too, had the same experience. In my alcoholism, I would go to the doctor occasionally, but I would always lie about the amount that I was drinking. And so I really didn't get the treatment or the care that I needed because it was so shameful.
It is.
I remember the doc, after he saw the liver enzyme tests, saying, well, how much do you drink? And asking an alcoholic how much they drink, it's the stupidest thing in the world because very few of us are honest. I'd say, well, I don't a couple of beers a night, maybe a little vodka, but that's about. And he said every day, and I say, well, at night, but to help me sleep or something like that. But you're never honest,
Yeah.
I drink to get drunk, Doc, and then I can go to sleep because I'm passing out. I mean, people don't talk like that to a doctor.
There's such bias in the healthcare industry. And so that's really our goal, is to just strip that away and allow people to be who they are, where they are, and we love them right where they are. And it works. We have people that have been with us in active addiction for years, and one day they're finally ready and they know they can trust us. And so we help them find the best treatment that they need. So yes.
My last wife was a nurse, and she sort of had the attitude, I probably shouldn't, I certainly won't use her name, but I hope she doesn't sue me, but it was sort of the attitude looking at people in addiction of, well, that's their choice. So, if that's the physical problems that are coming with it, if it's a infected wound or if it's an overdose, that's their problem. And which is really not a good way for a medical professional to look at people in addiction, right?
Absolutely. And I think anybody that's have been involved with addiction or alcoholism knows that, yes, maybe that first time is your choice, but that addiction takes hold and you are powerless. And so, no, that's not a great way to. Most of us wouldn't have gone to the depths we've gone in our addiction and our alcoholism if it was just a choice, but it takes hold. And so we have to understand that. We have to understand the disease.
And if you think about it, like doctors take the Hippocratic Oath and are supposed to treat everyone, I suppose, the same. But I always felt like I was being judged because I was doing it to myself. It's not like I came in and I was diagnosed with cancer and that wasn't my fault, that kind of stuff.
Right. That's why we were very careful. We have a brand new provider team, and we really vetted people out that had the passion to serve this community, because there is a lot of bias in healthcare, and we just do not tolerate that at all. And so the group of providers we have are passionate women who love this group of people and provide the highest quality care with no judgment.
I was impressed when I asked you how long it takes to get an appointment. And the reason I ask is I've been seeing the same doc for years now, and I can't, just to have a routine physical, and for an old fart like me, you're supposed to do it at least once a year. So for Social Security and that kind of stuff, they do a mental test, they give you 4 words and then talk about something else, then ask what the 4 words were. And I can't get an appointment any sooner than 6 months out. And so, and what are you going to do? And I ask you, so
Yes.
how that, like,
Right.
if I call you guys, and I say, I really want to get in, what kind of time frame?
Right now, because of our new team, we have a 1 week. We can get a new patient in next week. We're really ramping up our volume for this new year and this new fiscal year. So yes, and we prioritize, especially with those people that they're desperate. They need a place to go. We want to be able to get them in quickly and get the treatment plan started.
Wow, a week. And what happens if somebody shows up at the clinic just saying, I need help? What do you do?
Absolutely. We take walk-ins all day long. So yes, people are welcome to show up. We put them on the walk-in schedule. As soon as a provider has a no-show, we plug them right in. So yes, and our walk-in schedule is open from 8 a.m. to 5 p.m. So our walk-ins get seen.
It sounds almost too good to be true. So I suppose if I was watching this, I'd say, well, what does it cost? How do you handle finances?
Sure. So we, our primary funder is Medicaid, but we have grant options for those that are unfunded, and we will work out any kind of plan we need to. We take all insurances, but if someone is unfunded, we do not want that to be a barrier for them. We can find a grant or work out a sliding scale fee. So please don't let that be the reason you don't get treatment. We want those unfunded people. We want the people that don't have other options because we are their option.
So we've been talking about people who are in addiction and dealing with alcohol and drugs. What about, like my example that I just told you, what about primary? I need to find a primary care physician, and it's really hard to find right now because they're all booked.
Yes. So we do specialize in addiction medicine, but we do provide all primary care. So anything you would go to your provider for, we do. Women's health care, testing, anything, diabetes, help, chronic pain. Our providers provide family care. So yeah, we do it all.
And I guess a concern might be from somebody outside the addiction world. If I walk in, am I going to see a bunch of people sitting around who are drug addicts and alcoholics, or you know what I'm saying?
Sure,
what's the atmosphere?
Yes, absolutely. So yes, you will walk in and see people that are in addiction, but the environment is controlled. We keep a standard that we are a clinic, and so there's no active use going on. If somebody's impaired and needs help, we will put them in a private room. So it's a clinic. There's expectations of behavior, and it's a dignified place to be.
Do you have any questions? You go to the clinic, or you have, right?
I still do. I think my last birth control update was done at Martindale.
Not to get personal.
Yeah, I'm like, when you say women's health, I definitely was like, well, my last doctor was Martindale. Can I still go there? And they were like, yeah. So I use them as my gyno now.
Wonderful. That's wonderful. I think there is a misunderstanding that because we are associated with Odyssey House, that you need to be associated with Odyssey House to come to Martindale, and that is just not true. We are a community clinic available to anybody, and especially outside of Odyssey, we definitely want to serve you.
I have clients that I monitor the clients that go LACA, and a couple of the clients have been like, I'm really worried. I was supposed to get a medication refill, but I left against clinical advice. And the doctor I was seeing is at Martindale, and I love that I'm able to be like, just keep going. They're not just if you're a client. They are like an actual clinic separate from us. So it's really nice that they can still get the medical help that they need.
I think that's a misconception too. You know, that even though it's part of the Odyssey umbrella, it really, you guys are on your own, right?
We are. We serve everybody. We serve our partners. We serve just the community. We have people that are not in addiction or have ever been and that come to our clinic and have their primary care provider as one of our teams. So yes, it is. We are for everyone.
Now the hard part, let's talk about Tessa. You mentioned that you were in recovery as well. Can you talk a little bit about
absolutely.
your background with addiction?
Yes. I have been sober from alcohol for almost 11 years now.
Wow. Congratulations.
Yes.
You're amongst friends. She's amongst friends. We're both recovering.
Yes. I've got 13 years, so I've got you beat, but I'm a lot older. So, and you got...
I'm a baby, 3 years. Good for you, though.
Baby, for only 3 years. No, that's a great accomplishment. The first couple of years are I think, are the tough ones. You know.
It's been a journey.
Yes.
That's cool. 11 years.
Yes.
Congrats.
Yeah. Thank you.
How did it start?
Yeah. I think it started for me the way a lot of it starts for a lot of people is I had terrible anxiety. I had a very high pressure corporate job, and I was a workaholic and high functioning. I had a family, and I was going through a very difficult divorce. And I found red wine, and it eased that anxiety in myself, and nothing had ever done that for me before. I obviously wasn't taking care of my mental health, and so I found alcohol, and it just took off from there. And I was in active alcoholism for quite a few years. I had basically alienated every relationship in my life. I had lost the big corporate job. And
because of drinking?
Because of behavior that came from drinking,
right.
Yes. And they didn't know what to do with me, and I didn't know how to advocate for treatment. And it took everything from me. And one day I just had a moment of being very ill on the bathroom floor because your tolerance level's all over. And it was just a moment where I just knew that I was loved no matter what. And I had never felt that before, but I also knew if I kept drinking the way I was going to, I was going to die. Death was soon, or I could choose to stop and try to walk in sobriety. And I made the choice to walk in sobriety. And my goodness, what a journey. And I was sober for a few months, and I didn't tell anybody because my word didn't mean anything. I had told my kids multiple times I would stop, I would slow down, and I just couldn't. Alcohol was definitely the master at that time, but I made a decision to stop and walk in sobriety. And I really just one day at a time. I think that's so true. I think sometimes we, as alcoholics, the idea of never drinking again is just too much. So all I could do was slow it down to one day at a time, sometimes 1 hour at a time. But I found life again, and I found joy again, and I found that I could have fun in sobriety. So it's been such a journey, but I'm so grateful to be sober today.
Did you go through a program, or did you do
not.
it on your own?
I did not. I didn't even understand that there was a program. You know, I I did attend a lot of 12-step program or meetings, and that helped and provided kind of a basis and a community. And that was really great. And at the time I was working in an organization, and everybody in our organization had been sort of terminated except for this one woman, and she was in recovery from heroin. And she and I just worked together every day, and she taught me, keep it simple, like you're not in control of everything, let it go, and just kind of the basics. And that really kind of helped me that first year.
It's kind of funny that you say that you found someone that had a different addiction, because until I got to Odyssey, I didn't realize, well, first of all, I didn't really think I was an alcoholic, but then I realized I was an alcoholic. And then I realized I had so much in common with those that do, like IV users and all that. We're all the same. And I can remember thinking, like, drugs are so bad. At least, like, I'm just drinking.
Yeah. I'm not a heroin addict.
Yeah, obviously, like, I'm fine. And so I love that, because
Yes.
you find that it's the same. It's the same illness.
Yes,
not less
absolutely.
disease.
I think whether you're an IV drug user or a drug user or an alcoholic, it's the same. It's the same disease that drives us to numb out. We want to numb out, and we don't have to do that anymore.
Yeah.
I don't think you'll find anybody in addiction who is proud of their addiction. Hey, I'm a heroin addict and I'm proud of it. Or I'm a meth addict and I'm proud of it.
Unless they're like super high.
Well, yeah, you might say that. Well, yeah. Well, I used to say that when I was drinking. I love drinking, But and when I started out this podcast talking about shame, I think that's true of anybody in addiction, which is why it's so important to not be treated with judgment.
Exactly.
I don't know about you guys, but I was a rebel, and if somebody would tell me I had to slow down on my drinking, I would drink more. It was like, I'll show you.
Yep. It's wild. Yeah, I did the same thing.
Yeah, absolutely. Absolutely. I didn't
See,
want to
we
be
are.
told.
We haven't talked about this before, but we are pretty much the same.
Yeah.
We are.
It's a power and control thing, because I think as much as you are feeling like you're taking control by drinking, so you don't have to feel, so you don't have to do all of that, you are so powerless because you have to drink. And then when someone tells you you can't, it's just,
Yeah, I'll show you.
Right. Right. Yeah, for me, it was, oh, okay, I won't. And then secretly and then everybody always knows. I thought I was like being so secretive. No, I was a wreck, and they all knew it.
but you think you're so sneaky.
Yes.
Well, and the misnomer that nobody can smell it on your breath if it's vodka, that's bullcrap.
Yeah.
And when you stop drinking, I live in a high rise, and when I get on an elevator with somebody who's been drinking, I have no idea what they were drinking, but it's like they've been drinking. You can smell it.
And then you're like, I was not sneaky.
No.
No. Could people smell that on me?
Right.
I can't believe that.
100% they can.
I think one of the greatest gifts of sobriety is just that kind of that honesty with yourself of like, okay, like I'm going to be real here with me, and that's where it starts. And then you get to be kind of real with the world, and it's just such a better way to live, where you're not hiding and lying and manipulating. And I'm so glad that we're out of that cycle.
I hated the word alcoholic as it applied to me. Like you said, you didn't think you were an alcoholic.
I just didn't like to feel things, so I drink alcohol, which is totally different than being an alcoholic.
Well, absolutely, and I understand. So you're really not in recovery because you weren't an alcoholic in the first place, right?
Yeah, I just dealt with my anxiety, I guess.
Because
Self-medicate.
Yeah.
your comment struck home for me about, and it's so trite to say one day at a time. I realize it's trite, but I had been drinking. Drinking had been part of my life for 30, 40 years. And then to think that when I went to an IOP program, and to think that I couldn't drink for the rest of my life, I thought, wow. Yeah. And then when I found a sponsor who said, don't look at it like that, which to me at first was like playing mind games. Well, okay, so I look at today and tomorrow and don't worry about 10 years from now. And what's the difference? Because the end result is the same. But for my mind, it worked very well, thinking, okay, I made it through today, so let me think about tomorrow, and hopefully I'll make it through that. And then the days begin to add up, and you sort of slow down in thinking about the number of days, and all of a sudden, it's 13 years.
Right.
I mean,
Right.
that's a lot of days, you know.
Yeah. No, I think taking it one day at a time is helped me in so many ways in just my life, not just drinking, because I don't know, before I had coping skills, I would future trip about everything, about work, about life, about what I couldn't control, and just kind of letting that go and like staying in the moment and realizing I don't have a lot of control about all of that anyway. I think we'd like to have control, but like letting that go and sort of surrendering that and just taking today and being present and showing up and doing the things I need to do today, man, that's a life skill I just did not have before recovery.
And talking about our past. I mean, admitting stuff to people.
I never thought I would ever talk about it because, the shame of like talking about it, and then to do even podcast or to sit with clients in a room and tell them like I've done that too. I never thought I could do that.
Well, and I've known you since you've been in treatment, and you really have come a long way in terms of you being comfortable with being honest about your past.
So I was dishonest.
No,
I'm just-
it's just that it's easier for you to
Yeah.
talk about now than it used to be.
Yeah, I think it's seeing how much you can help someone by just sharing your story. Like, and then you see the power in it, and it's not like I have nothing in common with them. How can I help them? You're like, I hope I can help them somehow. Like,
Right.
if you hear one thing I say and it helps you, then I did a good job today.
Absolutely.
And you don't have to be in recovery for your staff at Martindale, right?
No, absolutely not. We have staff that are in recovery, and we have the majority of staff that are not, but just care about serving people. So, yes.
What I don't want to sound like a commercial, but what does if somebody hears or sees this podcast and thinks, well, I might like to go to Martindale, what should they do?
Yeah, absolutely. They should just give us a call at 801-428-3500 and just inquire. We'll answer your questions. We'll set up an appointment. If they want to come see it, I'd be happy to show them around. You can ask for me directly, Tessa, and I'd be happy to answer any questions. But yeah, just give us a shot. Come see what we're about.
I like the fact that you're so accessible. I had a complaint from somebody about some care in the past, and one of the things I do is respond to our reviews on social media, and your response was, have them call me.
Absolutely, yes. If you've had a bad experience with Martindale, I would say I'd love to hear about that. With our new team and the new direction we're going, we really want to shift the focus and make sure that we are patient-driven in everything we do. So I'd love to talk to anybody that has questions or maybe didn't have a great experience in the past. I'd love to be able to correct that.
That's pretty nice, isn't it?
Yeah.
Talk to the top person, and she'll take care of it. Yeah.
Yeah. I mean, I get the honor and privilege of working with this team, and we are all in this together. So top person, front level person, like we're all the same.
Great. Tessa Basinger, head of the Martindale Clinic, thank you very much for being on this podcast.
Thank you
You said
so
you were
much.
nervous. It wasn't as bad as you thought.
It was wonderful. Thank you. It was talking with friends. So thank you.
Exactly. Good to see you again, Nicole.
You too.
And for those of you watching or listening, we thank you for checking out another edition of Odyssey House Journals.